Welcome back. We're continuing our discussion with Cindy Sturgar, the CEO of the Montana Primary Care Association. In the previous segment, we talked about how community health centers provide services to the underinsured or uninsured, and how federal funding helps community health centers provide those services. Welcome back, Cindy.
Thank you.
What is the percentage in Montana of federal funding revenue for community health centers?
So it's different for every community health center. So depending on when you started, you may have had a grant, and at that moment that grant might have been 60% of your funding. And as you continue to mature and provide services, it may be a much smaller percentage. But today in Montana, we receive about $35 million in federal funds to help make sure people have access to primary care in the state. So it's just different. We have big centers in Missoula and Billings and very small centers in Chinook, Hamilton, some of the smaller communities.
So I understand recently, and it's been in the news, that Congress reauthorized some funding for community health centers. And I'm sure the issue of not authorizing that funding had to have caused some heartburn. Can you talk about that?
Yeah, it sure did. So if you start a business, like any small business, and you are running off a certain revenue, and all of a sudden that revenue stream gets stopped, it puts a hold on a lot of planning and expansion. So for some of our smaller sites, they were quite concerned that they may have to close because it was a large percentage of their revenue. In our larger sites, they were probably, their revenue was more robust, but they had to hold back on expansion. There was concern on hiring folks because people were hearing things in the media and wondering if the place they might want to go work might not have the base funding that they needed. So there was a lot of serious concern, both in the public, in the staffing, and of course the administration of those organizations, trying to make decisions about future needs, knowing that your revenue was uncertain. So that took almost 8 months before Congress came to resolving a part of that. There's still a small piece of that that's still unresolved, as it is for everyone. There's still a continuing resolution right now, but hopefully that's going to get settled out this month, and we'll move forward in a full budget. But it was very disheartening to go through that waiting period with Congress right now. Our goal is always to provide access to all of our patients, and health care is such an important right for folks in our communities that to create a scare around that was a little frightening for people. So we will continue with whatever kind of funding we get at any point. But it did kind of put a little bump in the road for us this year as far as planning, trying to expand. So even though we have 70 sites, there's still a lot of small communities that we had plans to open clinics or open dental centers in, and those plans had to be kept on hold until the funding got settled out. So it was quite a year. It was quite a year for all of us.
Absolutely.
Yeah.
Worst case scenario, if Congress were to completely cut funding for community health centers, what would that mean for the citizens in Montana and, other states in the nation?
Yeah, I think it's really, as we all get more informed about healthcare across the United States, at whatever age we are, we come to understand that that provider and that team that works for us is a part of our life, and we really rely on them. So in rural frontier areas, some of the communities only have community health centers to go to for a clinic, right? Their clinic is a community health center. So if that funding would become severely limited or cut all the way, many of the rural frontier sites would end up closing. So people that live far from our bigger cities would really struggle in transportation, right? Trying to get to health care in a reasonable amount of time when they need it. So it's a big concern, especially in rural frontier areas. In bigger populated cities, not in Montana, they have pockets where people have not had health care. So some places in their communities would go without that again, so certain special populations probably would not have access to care. So it's a pretty serious issue. The good news is there was a lot of bipartisan support, so this isn't a partisan issue, right? Healthcare gets a lot of support from both sides of the aisle. It just was, there was a lot of confusion in DC. It seemed like this year for them they struggled to get anything passed. So it was too bad that healthcare was one of those things that they struggled with.
Talk about the importance of community health centers for the children.
So access to care, as we know, is for everyone, especially for children. So what we saw with children, just like we saw with community health centers, is the CHIP funding. And in Montana, we have many of our people, kids that are covered by the CHIP program. So we are an access point for children, both on the medical side, on the dental side, and on the behavioral health side. So in our certain centers, you can have your baby there, you can get your prenatal done, you can have your children see their pediatrician, they can go to the dentist there. So all of those early childhood interventions in healthcare that make a difference when we're older. So research has shown that if you are taken care of when you're born, before you're born and when you're a baby, you will live longer better. So community health centers do a really good job in that access area.
Oh, that's great. Up next, we'll be talking about a community health center in Helena. Stay tuned.